By 2050, 10 million people are predicted to die annually from antibiotic-resistant infections, which is fueling a desperate need for new therapeutics. One treatment is phage therapy, which uses viruses that infect and kill bacteria to treat infections. We partner with clinicians at the Queen Astrid Military Hospital, where patients are actively treated with phage therapy. We have analysed patient samples and shown we can predict treatment outcomes and why phage therapy is successful. Little is actually understood of what goes on between a bacteria and a phage when they are inside the human body. So every case study we analyse can tell us something new about phage therapy. Our collaborators give us unique access to patient samples, which we can then analyse in the laboratory to uncover how these bacteria and phages have interacted during treatment. We bring our expertise in evolution to understand whether the bacteria have become resistant to the phage and what the consequences of this resistance are for treatment success. We have found that resistance has resulted in the bacteria becoming worse at being infectious, which is likely why treatment was so successful. Our clinical partners benefit from this insight as they can try and then replicate this in further case studies. Our partnership with Dr. Jean-Paul and his colleagues allows us to understand the knowledge gaps and problems currently facing phage therapy where it is actively being used. We know from our collaborators that phage resistance is a real worry for the community, and it is really valuable to show that in these case studies that resistance can actually be beneficial for treatment success. As a result, clinicians may instead try to tailor treatment approaches so that resistance has a clinical benefit rather than just trying to avoid resistance altogether. Phage therapy is a complex treatment requiring these discussions between different fields.